The root cause of most cardiometabolic diseases, such as diabetes, prediabetes, is actually aging and lifestyle. When we age, our metabolism slows down. We lose muscle, and then we start stacking fat that increases inflammation, insulin resistance, and this is how we become diabetic. Any new solution that will reverse diabetes has therefore to be born in lifestyle medicine and the new frontier of longevity medicine. And this is what the L-Nutra Health Program is about.
How come we keep using tons and tons of medications to manage the symptoms and signs of age-related chronic diseases? It was that kind of realization that I began to ask the questions, are we practicing medicine the right way? Getting the hemoglobin A1C to less than 6.5% for 3 months without the use of a medication. For the first time, the scientists around the globe have gotten together to define what remission is. Patients now have a goal to move towards.
The L-Nutra Health Program was born at the convergence of lifestyle medicine and longevity medicine. We take care of patients at home, we help them reverse their biological aging score, and we help them change their lifestyle, and therefore effectively increasing disease remission between 300 to 700% over current medications alone.
In the past, dietitians have only really had tools of education and encouraging behavior change and setting goals and habits together. But this changes all of that because we actually have a true interventional tool, a food as medicine tool that not only changes the life of patients, but it changes the life of the practitioner. This is the first time I feel like dietitians have a true food as medicine intervention tool that we can use cycles of, coupled with lifestyle change and behavior modification, which prior to this tool, that was the only thing that we had. But now we have an intervention that actually works on a cellular level and makes a big impact.
We have spent 36 years in R&D to offer products that people can consume that help them rejuvenate their cells. A process is called autophagy, and it's actually a cellular rejuvenation. When you rejuvenate your body, you rejuvenate the muscle so that you burn the carbs. You rejuvenate the pancreas so it produces, again, insulin. You rejuvenate the entire biological age score of the body so that we are more effective in the way we process carbs and we pull away from the disease.
People struggle with consistency. They need help, but perfection is not the way to go. That's where a program like the L-Nutra Health Program that couples FMD, treating the root causes of diseases, and allowing you to have a little bit of life. It affects the body on the cellular level, allowing the body to do what it innately knows how to do. It goes into this cellular cleanup mode where we see reduction in inflammation, reduction in insulin resistance, improvement in gut health for an overall improvement in your metabolic health.
I think by going down the path of driving towards disease remission, we're on the right side of history. Think about nutrition, but not only in a supportive role. Think about nutrition as an intervention. Think about using new tools in nutrition through our understanding of molecular medicine to drive better outcomes, and that is disease remission.
Patients do not have to resolve to take 6 and 7 medications as the norm, but that's what they've come to accept. They can challenge that. They can impact their health on the cellular level and cut back over time on their medications.
In April of 2024, I was diagnosed with type 2 diabetes. I luckily had already been doing research on this, on diabetes. I was not very familiar with it and learned a lot about it, including that remission was possible. And so when I left the doctor's appointment, I left with a plan to try to join the L-Nutra Health Plan, meeting with the dietitian and continuing to improve my health, eat better, and exercise more. When I got involved and started talking to L-Nutra Health about the program, I was immediately impressed by how engaged they were, because I think it was a pivotal point in my shift from being diabetic and pre-diabetic to being normoglycemic again. for the first time in many years.
People truly feel more energy. They have less cravings. They feel empowered. They know they can make a difference. And it's true. There's a scientific reason. When we go through the 5-day FMD, the hydration of our skin is improved. Therefore, it truly is more hydrated. The texture is improved. People feel all of these changes. They feel mental clarity for the first time in years, and they want to continue on.
It is core to our mission at L-Nutra Health that we help as many patients as possible. The biggest discovery is that those are age-related diseases, and therefore, longevity medicine, aging medicine, is the new frontier of modern medicine. The L-Nutra Health Program is a paradigm shift in medicine and healthcare. It is giving patients for the first time hope that one day they will be free of their diabetes or cardiometabolic disease and not be called patients and not have to fulfill prescriptions for the rest of their lives.